Good afternoon. Thank you very much for joining us again today. I'll start with the usual run-through of the daily statistics with apologies in advance. Parts of my briefing today are a little bit technical because it's about how we report figures, and while it might seem a bit difficult to follow today, what I'm going to report to you, particularly around people in hospital, is in the interest of making these figures more accurate and more transparent as we go into the next phase of tackling the pandemic. But I can report firstly today that the total number of positive cases reported yesterday was 267, which represents 3.6% of people newly tested. 101 of these cases were in Greater Glasgow and Clyde, 59 in Lanarkshire, 53 in Lothian and 13 in Ayrshire and Arran. The remaining 41 were spread amongst the other 7 mainland health board areas. However, to be clear, and this is a point I want to stress today, these, as indeed our daily figures always are test results that were reported yesterday. But because of the backlog in the UK-wide system that I referred to yesterday, this figure will include a bit more than it normally would, results from swabs taken over the past few days. We hope that the backlog of the past few days will have worked its way through the system shortly. And just to be clear, to reassure you, for the purposes of our trend analysis, tests are looked at by day of the sample, not just by date of reporting, to ensure that we are tracking the increase in cases accurately. And from that analysis, of course, right now, unfortunately, we do know that cases are rising. Now, as I said yesterday, I do have a concern about the capacity constraints right now within the UK-wide system. And for Scotland in recent days, just to be clear, this has not been an issue of access to testing slots at regional testing centres or mobile testing units, but instead it has been one of access to sufficient lighthouse laboratory processing. And it is this that has led to a backlog in the system and longer turnaround times for tests than we want to be the case. Now, as this is a UK-wide system, we are not able to resolve this on our own, and the issues are impacted by demand elsewhere in the UK. To that end, I had a conference call, a constructive conference call last night with Matt Hancock, the UK Health Secretary, and Dido Harding, who is head of the UK testing system, to seek, firstly, assurances that Scotland is and will continue to get fair access to the UK-wide laboratory capacity, and also discuss how we can resolve these issues. So I hope to see improvement over the next few days, but of course I will continue to provide updates. I also, and this takes me into the slightly technical bit of the briefing, I want to provide some context before providing today's update for the number of people in hospital with COVID. Now, if you cast your minds back a couple of weeks now, I think, if you're one of the regular viewers of this briefing, I indicated then that we were looking at how we report on numbers of people in hospital. Under that measure, the one we have been using up until now, lots of people are classified as being COVID patients, even if they have recovered from COVID and are now being treated for a condition that is unrelated to it. Now, that old measure provided accurate information at the peak of the epidemic of this first phase back earlier in the year, when there were around 1,500 COVID patients in hospital. But as the pandemic has progressed, we have been reporting a higher number of hospital cases than is probably justified, and that's the issue I alluded to a couple of weeks ago. For example, in late August, Scotland officially accounted for almost 1/3 of the hospital patients with COVID in the UK, despite having 1/12 of the UK's population and a relatively low incidence of the virus at that stage. So to try to ensure that we're no longer counting patients who no longer really have COVID, we are from now, and I'll report under the new measurement today, but then regularly from tomorrow, we're moving to a new definition. From now on, we will count patients who first test positive for COVID during their current stay in hospital or in the 2 weeks before their admission. In addition, we will stop classifying them as COVID patients for statistical purposes after 28 days in hospital or 28 days after the date of their positive test, whichever is the later. Now, this new measurement will be an improvement on the old one, but it's important for me to point out it will not be absolutely perfect. The effects of COVID, as we know, sometimes require hospital stays of longer than 28 days, so a small number of patients with COVID might not be captured by the measure I've just outlined there. So I've asked Public Health Scotland to develop analysis about patients who unfortunately end up spending longer in hospital. But overall, this new measure will give us a better picture both of the current situation in hospitals and, crucially, given the phase of the pandemic that we are going into, it will be more sensitive to the changes in hospital admissions caused by new cases. So it will be able to enable us to more accurately reflect and report any increase in hospital admissions over the next period. So under the old measure, I would be telling you, and I am going to tell you, that 262 patients are in hospital. That is 2 fewer than yesterday. But that's the last time I'm going to give you that old measure. Instead, I'm going to move to the new and more accurate measure, and I'll use that solely from tomorrow onwards. And under that measure, as of today, there are 48 patients in hospital under that more narrow but more accurate measurement. And we'll be able to track better now the increase in hospital admissions from here on in. And also, using the new definition, I can report that there are 6 people in intensive care. Under the old definition, I would have been reporting 7 in intensive care. So clearly the change in measurement doesn't have the same impact on numbers in intensive care as it does on broader hospital numbers. And finally, in terms of my daily statistics update, I regret to have to report that in the past 24 hours, 1 additional death has been registered of a patient who first tested positive over the previous 28 days. And that means that the total number of deaths under this daily measurement is now 2,500. Now, that total serves again to remind us of the impact of this virus and why we can never ever be complacent about the risk it poses. And I want again to pass on my condolences to everybody who has lost a loved one, including, of course, everyone who is grieving as a result of the death that was registered yesterday. Now, there's a couple of other issues I want to address before Jason, Leitch and I will take questions from the media as normal. The first is just to report here, we made this public last night, but I thought it was worth reporting that we had a meeting yesterday, as I indicated earlier yesterday that we would, to discuss the current position in Greater Glasgow and Clyde. And the good news is that the early indications suggest that the restrictions in place in Glasgow City, East and West Dunbartonshire, Renfrewshire and East Renfrewshire might be helping to slow down the increase in new cases. So that at this stage is positive. But the number of new cases in these parts of Greater Glasgow and Clyde still remains high and is still increasing, albeit we think at a slower rate than would have been the case without these restrictions being in place. So taking all of that into account, and the local authorities for these areas were present at the meeting yesterday, we agreed that the existing restrictions should remain in place for a further week, and then they'll be reviewed again at that stage. So that means people in these areas, Glasgow City, East or West Dunbartonshire, Renfrewshire and East Renfrewshire, should not be visiting other households at all just now. And of course, these same restrictions now also apply as of last Friday in North and South Lanarkshire. So in all of these 7 local authority areas, you should not host someone in your home unless it is for essential care purposes, and you should not visit someone else in their home, again, unless it is for care purposes or delivering shopping to a vulnerable elderly person, and that is regardless of where they live. So I live in Glasgow City, I can't have people in my home, but equally I can't go and visit my parents, for example, who live in Ayrshire and Arran, which is not one of these affected areas. Now, the second issue I want to cover today relates to the Test and Protect service. We have become aware that some fake callers are pretending to work for Test and Protect and are trying to con people by claiming that payment is needed for a test. Now, sadly, this reminds us that there are always a small number of people, it's a tiny minority, but nevertheless they're there, who will try to exploit any situation they can to defraud people, and it is truly and utterly despicable, particularly at this time of crisis that we are living through. But in light of it, I wanted to take the opportunity today to remind you and to ask you to remind others that you know that COVID tests are free and will always be free for those who need them. Nobody from Test and Protect will ever ask you for financial information. They will never ask you for your bank or credit card details, and they will never try to sell you anything. The only thing Test and Protect staff will ask you about is where you've been and details of the people you've been in contact with. Genuine contact tracers will often also first send you a text to let you know that you will shortly receive a call from NHS Scotland. Callers will always introduce themselves, they will state the reason for their call, they will know your name, and they will ask you for details of people you've come into contact with in a relevant time period. And they'll tell you that you will receive further information by email or post. And they will always call you from the same number, 0800 030 8012. And they will also give you the option of calling back on that number if you need to verify the service. Now, there's a lot of useful information about this on the coronavirus sections of the Trading Standards Scotland website and the Advice Direct Scotland website. You can report any concerns about calls you've received to Advice Direct Scotland, and if you are unfortunate enough to have been the victim of a scam or an attempted scam, you should contact the police on 101. Now, fundamentally, if a person claiming to be a contact tracer is asking about things that aren't necessary, in particular your bank details or computer passwords, then you should just put the phone down on them straight away, because they are not a legitimate contact tracer. And as I mentioned earlier, if you do get phoned by a legitimate contact tracer, you have the option of phoning them back. Again, 0800 030 8012 if you want to verify the call. Genuine contact tracers will only ever ask about your movements and details of the people you've been in contact with. So this is a small minority of people. Hopefully it will not happen to any of you watching, but I thought it was important to take the opportunity just to stress what will and will not be asked of you if you do get one of these calls, so that together we can make sure these people who attempt these scams, these despicable people, don't get anywhere in Scotland. Now, the final point I want to make, just to round off, is to remind you of the new rules that came into force yesterday, and of course all of our other important public health guidance. As you all know, unless you live in one of the areas I've already spoken about where stricter restrictions are in place, no more than 6 people can now meet up together, and those 6 people can come from no more than 2 households. Children under the age of 12 don't count as part of the total of 6, but they do count towards the total for households. I said on Friday I was looking for some further advice on whether we could give greater flexibility for children, and I hope to give the outcome of that later this week. That rule, 6 people and 2 households, applies indoors and outdoors, in homes, pubs and restaurants, and in outdoor spaces such as parks and private gardens. Please make sure that you're not breaching those limits. This step, limiting the number of people in households you interact with, it's a tough one. It's really not an easy one or a welcome one at all. But it is a really vital step in helping us to keep the virus under control by limiting the interactions that we know are most likely to cause it to spread. Please also, if you haven't already done so, download the Protect Scotland app if you can. I know that the last time I looked this morning, around 950,000 of you have already done that, but we want as many people as possible to do so. It's very quick and easy to do. It's a simple but very powerful way of all of us as individuals helping the country collectively. And as always, and this will be my final comment, remember all of the other things that we all need to do to try to minimise the risk of COVID spreading. And all of that, of course, is encapsulated in fact, the 5 golden rules to try to minimise the spread. Remember to wear face coverings in closed spaces. Remember to avoid crowded places. Remember, tiresome though it is, to clean your hands and hard surfaces regularly. Remember to keep 2 metres distance from people in other households, and remember, crucially, to self-isolate and book a test if you have symptoms. So thank you for bearing with me through what I know was a bit of a technical briefing today. Occasionally they will be like this because we are trying as we go through the pandemic to make sure that we are reporting information in as clear, accurate and transparent a way as possible. And as we go through different phases, sometimes that means changing definitions that we have used previously. So explaining that takes a bit of time, but hopefully over the next period, these things will become much clearer for all of us. Thank you for listening, and we will now go straight to question. Jason is here to help me with the answers, and first up today is Lisa Summers from the BBC.
First Minister, I wondered if on testing, you know what proportion of people in Scotland are missing the 48-hour target at the moment to get their test results back, and perhaps could NHS labs step in and help in Scotland for critical workers like care workers, for example, to help get them tested more quickly, or the results more quickly, I should say. And I wondered if I could ask a question to Professor Leitch as a familiar voice to football fans in Scotland. Are you worried about the number of football players testing positive for coronavirus, particularly after 3 Hamilton players tested positive again today?
I'll take the first part of the question and then I'll hand over to Jason, who can add to what I say, but also take the question about football. On the figures, the turnaround times, I don't have the up-to-date figures in front of me. We're looking at yesterday's figures, the ones that have been processed today, to try to get the most up-to-date sense of that. And we will obviously continue to give more information as we can get it. We hope that this is an improving situation, but the turnaround times right now are not as I would want them to be for everybody. That is not to say that a lot of tests are not still being processed within 24 or 48 hours. They are, but there are too many that are not being processed that quickly, and that's the issue working with the UK government that we are trying to resolve in terms of any accumulated backlog over the last few days, but also to try to make sure that as we go forward, we are not accumulating any further backlog. And I will keep people as updated on that with as accurate information as I can going forward. It is important that I stress this is this bit of our testing system is UK-wide. It is not as simple as just diverting tests from a Lighthouse lab to NHS labs, but the possibility of that in future is something we are exploring. So this UK-wide part, we have to work with the UK government to try to resolve issues. But of course, we are also looking at how we can expand the capacity over and above that to perhaps to expand the capacity generally, but also where necessary to take some of the pressure off. So, for example, right now our regular care home testing goes through the UK Lighthouse lab part of the system. We are looking, and some health boards are starting to do this, to take that into NHS labs to try to free up some capacity in the Lighthouse. So when I talk about this being a UK-wide challenge, it's because it is. It's not me trying to pass the buck. This part of our system where, if you're a member of the public, you book through the portal and go to a drive-through or a mobile testing unit, that is a UK network, and therefore we have to work with UK government colleagues. It is impacted by demand elsewhere, just as if demand is higher in Scotland, that will have an impact in other parts of the UK. One of my as you will understand, real preoccupations, and it was one of the things I was seeking assurances about on the call last night, is that Scotland will get a fair share of this, and you know, I am confident that will be the case, but we will obviously closely monitor that as we look to see whether there is more we can do within our NHS network to relieve that pressure and build overall capacity. So it's a complex system, but it is one that we here in Scotland are very focused on making sure works in the way that we need it to. And I will now happily, on football, hand over to Professor Leitch.
So I add just a very brief comment on the labs, just to say that this is a very complex logistical exercise of demand and supply and the swab taking and then the analysis of those swabs, and all of that system is working together as best it can, both to get help with that backlog. And you're right, in some of those priority groups, it may be that in the fullness of time we have to move those groups around where those testing are. We have very good people both in the Lighthouse labs for us working on that, very senior academics running those labs, and our health protection teams, our laboratory leaders inside our health boards working on that every day. You can be absolutely certain, if it reassures you at all, that we have very, very good people working on getting that down as fast as we can. Football, I actually think, Lisa, this suggests the opposite of what you suggest, that football has worked really hard to get a testing regime in place. So you saw St Mirren unfortunately lose 2 of its goalkeepers last weekend. We had GPS data of where they had been. We had test results confirmed in the NHS testing processes. They were isolated. The game went ahead. Everything worked exactly as it should, other than, as far as we know, no rule breaks. 2 individuals did get the infection from the community somewhere. So no, I don't want anybody sick, footballers or otherwise. So today, St Mirren have announced, one step before that, St Mirren have announced 3 positive tests in the private testing regime that we use across the whole of that football league. We will now isolate those individuals with their families, and we will look at the GPS data of the training. We'll work out where they were they in the changing rooms, were they in the coffee shop, where were they? But we'll also redo the tests in our NHS labs because we have added technology there which will allow us to confirm or remove those positive tests. So actually, difficult for Hamilton. I completely understand that it's hard for them to lose 3 players even for a little while, but Test and Protect works there just like it works in a call centre, and it's working really well.
Gordon Cree from STV.
First Minister, a couple of points for both of you, if I may. I'm in Bathgate at the moment because there's growing concern about the rising number of cases in the Lothians, and people here are wondering if it's inevitable that the type of restrictions we've seen further west will come to this part of the country. Do we think these case numbers in the Lothians are down to anything specific, or is it just because it's the next most populous area? And separately, on football, if I can ask, with these further positive tests, what impact you both think that ongoing situation has on the short and medium term future of football as an event, and in particular a spectator event?
Obviously, I will again hand over to Professor Leitch to perhaps say more about football, but we paused the move to having spectators back in stadia last week as part of our overall pause in the route map, given the recent rise in cases. So we will review that again when we come to the next review point. And, you know, I wouldn't say that having some positive cases, which as Jason said, is a sign that the regime in football is working to identify and then isolate cases. That in itself wouldn't necessarily be the deciding factor there. It would be one of many factors, not least the overall situation that we would take into account. Briefly on Lothian, we are monitoring the case numbers in Lothian very closely. The incident management team, the national incident management team that met yesterday that ultimately made the recommendation to continue the restrictions in the Greater Glasgow and Clyde areas, looked closely at Lothian yesterday and decided not to recommend any additional restrictions, but that remains under review. And one of the reasons for that decision not to recommend additional restrictions at this stage is that, unlike in Greater Glasgow and Clyde and in Lanarkshire, there wasn't a sense that there was a particular driver that necessitated particular restrictions at this stage. But as with every aspect of COVID, this is a changing and changeable situation, so we will monitor it. My final point on it is it inevitable? Maybe this is just the way I choose to get through this situation we're dealing with right now. I don't want us to think of anything as inevitable. All sorts of things may come to pass. This is an infectious virus that we can do our best to control, but it unfortunately has its own ideas about things at times. So things may come to pass, but let's not act on the basis that anything is inevitable. We know we can suppress this virus because we did it over the summer. And if we all abide by the restrictions that are in place nationwide, apart from the areas where there are stricter restrictions. So in Lothian, if everybody abides by the restrictions to limit meet-ups with other people to 6 people from 2 households, if they all follow the facts advice, if they download Protect Scotland app, if they do all of the right things, then we can hopefully avoid any stricter restrictions in Lothian. So let's all think about this as a situation where we know what we're up against, but we're not powerless, and we don't have to accept any particular trend in this as inevitable if we all do the right things.
I agree. Lothian is next on the league table. You're absolutely right, but there is no theme coming through from Test and Protect that tells us to do anything more than what we've done across the whole country. Bear in mind, Lothian is more restricted than it was 10 days ago, as is the whole country. The 6-2 rule is more restrictive than it was, and we did that because of rising numbers across the whole nation. We hope that that in place for a few weeks will allow those numbers to fall or at least not accelerate, but we watch it very, very carefully. And it is up to the people of Lothian to get those numbers down. Their individual behaviours will do that. It's not inevitable that a populous area goes next. That's not how this virus works. You saw us restrict Dumfries and Galloway. You saw us restrict Aberdeen. So it's not necessarily that it comes in a wave across the central belt. That may be what happens, but it's not inevitable. I also agree with the First Minister around what we will take into account when we advise her about crowds in stadia, be they football, rugby or whatever other sport. Individual players getting positive cases through no rule breaches doesn't seem to me to affect that trajectory. What does is increased prevalence of the virus in the community. That definitely affects that trajectory, and we'll have to be very, very careful. The other thing is the quality of the test event. So we're expecting a report later this week, I think tomorrow maybe, on how those 2 test events went on Saturday. My early indications are they went very well. Everybody followed the rules. Everybody came in and left, and transportation worked. And that progressively will help us then make choices as we advise the First Minister about what to do about the return of those sporting crowds.
And these will be, tough decisions, like all the decisions are tough. There are many countries across the world right now that are pulling back again on attendances at big sporting events. So that's just the nature, unfortunately, of what we're dealing with just now. Tim Backshaw from ITV Border.
Thank you very much. Given the testing issues you've talked about, how worried are you that this could start to have an impact on the staffing of care homes, schools and the like if people can't get those test results quickly?
Well, I am concerned, as I think you've probably gathered from the fact I referred to this yesterday. I've had discussions last night. I've referred to it again today. I am concerned about any constraints in the system that is lengthening the turnaround time. We know our Test and Protect system is working really well, but it works best if the time from somebody getting a test to the test result being reported to the contact tracers getting to work is as short as possible. Now, the bit that our contact tracers are doing is still being done really well and really quickly and with a very high level of success. The bit that we are a bit more worried about just now is the bit from the test being done to the contact tracer becoming aware of the result. Now, that's the bit that we are working with the UK government to try to close. And I hope this will be an improving position. There have been, at the moment, Scotland a couple of weeks ago when our schools went back, we had a spike in demand for testing that calmed down a bit after a few days. We may see that again as our universities and colleges go back. And we at the moment, this is not in Scotland right now, a problem of having sky-high demand for testing. Our demand for testing looks to me to be appropriate given the prevalence of the virus. But we know that England, like Scotland did when our schools went back, have had a spike in demand as their schools went back. And that is putting a lot of pressure on the system. Now, in Scotland, that is not about, by and large, getting access to tests. There was reports yesterday of whole parts of England where you couldn't book a test yesterday. That's not been the case in Scotland. The issue is just the constraints in the Lighthouse laboratory slowing down the test results. Now, we hope that will resolve itself, but we will obviously continue to monitor this on an ongoing basis and discuss it with the UK government and look at solutions that we can bring to bear. It's a UK-wide system. The UK government are an overall sort of oversight of it, but we want to be a constructive part of finding the solution. So I said earlier on, one of the things that we are looking at is taking our care home testing into the NHS lab strand to free up capacity and make sure that we don't have those delays in the care homes. So what I would say to people is anything that is slowing down our testing system is a concern to me, but be absolutely assured that we are paying very close attention to this. I have, spent an awful lot of time on this, even just over the past 48 hours, and will continue to do so. And if there are problems that we think you need to know about or that we're not getting resolved, we will update you on, however difficult that may be, because I've tried throughout this to be open and transparent with the challenges we're facing as well as the progress we're making. Lewis Mickey from Bauer.
Thank you, First Minister. Just in terms of that test result backlog, Councillor John Alexander from Dundee City Council yesterday suggested a local company, Tayside Scientific Services, who are apparently willing and able to kind of help out with the processing of that tests. Is that something that's possible? Can private companies volunteer to help with this, or is it quite complicated to be able to sort that out?
So a bit of both, Lewis, to be honest. We always want to explore any opportunity to expand overall capacity. So I will follow up or get my officials to follow up with John Alexander to make sure that we're aware of that company and we're looking to see whether that is possible. The bit that's not quite as simple as just this system, there is a system, the UK-wide system, where you book through the portal or you get a home delivered test. And if you book through the portal and go to a regional testing centre or a mobile testing unit, then there is a system that takes those tests, takes them to the Lighthouse laboratory, then they're processed there and the data flows back through a system. So it's not quite as simple as just diverting some of those tests to another company or to an NHS lab. That's not to say we're not exploring all ways of doing that to relieve pressure and build overall capacity. So, but I don't want to give the impression that it is as simple as just flicking a switch. It is more complex than that, but we are exploring all of these options at the moment. Greg Fluker from Original FM.
Good afternoon. Yesterday it was confirmed police had been called to more than 400 house parties last weekend, where they made 6 arrests and issued 1 fine. The weekend before there was 18 fines for a similar number of call-outs. Are you satisfied that the rules are being enforced strongly enough?
I'm absolutely satisfied and confident in the approach that Police Scotland is taking. I'll be pretty blunt though, Police Scotland shouldn't be having to go and break up house parties like that, and they shouldn't have to be facing abuse as they did, I think, in a couple of cases over the past few days when they do so. I know I keep saying this, but I keep saying it because it's true. I know how dreadful this situation is for everybody right now, and I know how dreadful it is, particularly for young people. I've got, young people in my own life who, tell me quite regularly at the moment about how dreadful it is in terms of how they're living their lives. I understand that. I want nothing more than to get back to a situation where young people can go and have house parties and socialise in the way we all used to take for granted. But right now that can't be the case because COVID is there. It's not safe for young people to get, even if their risk is low. And we know if community transmission rises, older and more vulnerable people will get it. There is a sense, and I've covered this a few times over the past couple of weeks, there's a sense just now, because it looks to be the picture in our data, that cases are rising, but because they tend to be more amongst young people than was the case earlier in the year, hospital admissions are not rising at the same rate, deaths are not rising at the same rate. There's a sense, well, why are we bothering about this? Don't be complacent about that. The likelihood is what we're seeing here is a time lag. And if you look at, I was looking at Marseille in France last night, they are now reporting, having seen this increase in cases starting amongst younger people, move into the older population, and they're now reporting that their hospitals are facing saturation point again. So that's what we're trying to avoid, and we're not trying to cramp anybody's fun here, but if we all do the right things, then we'll have a better chance of avoiding the inevitability of that kind of situation. So I just say to people, please, please, right now, abide by the rules, abide by the limits. They're there for a reason. And if we all do that and we manage to minimise this, we might get back to that day when people can socialise as normal a bit more quickly than we would otherwise do. And I want to thank the police for the role they're playing in this, but ask everybody to try not to make their job more difficult than it has to be. Do you want to add about why it's important to stick to these rules?
Surely people know that by now. I have learned from the Chief Constable and his colleagues the 3 E's of policing: engagement, education, enforcement. And it seems to me that if we can stick with the first 2, that's the way out of this. we shouldn't need to send the police to people's houses to get spat at and assaulted, which is what I heard the Deputy Chief Constable Malcolm Graham talking about yesterday. It's horrible. And the reason we've had to send them is because people are putting themselves and others at risk. That seems to me just a stupid thing for people to do, young or old. So they shouldn't do that. And everybody else should try as much as you possibly can to stick with those limits, because the virus just looks for households to bridge. It looks to get from a household that already has the virus, even if you don't know, to another household that doesn't. That's why you've seen numbers rise in Marseille. It's why you've seen numbers rise in Scotland.
Thanks. Katrine Bussey from PA.
Hello, First Minister. I wanted to ask, if I may, about what seems to be quite a concerning development about these scam phone calls that you mentioned earlier. Do you have any indication of how many such phone calls have been made? If people have been conned into paying money as a result of them? And is this something that Police Scotland or perhaps some other authority are looking into to prevent happening?
I've given the details already of what to do. So if the police get reports about this, the police will investigate that. Of course they will. And I've already given some information about websites that people can go to. I don't have numbers for how many we're talking about right now, or whether, and to what extent they've been successful. I'll see if we can get you any more information. But the reason I'm raising this today is at a very early stage to hope we can nip this in the bud. This, unfortunately, you always get a minority of people who try to exploit any situation. But if we're all aware of what a contact tracer will do when they contact you, the number they'll use, the option they'll give you to phone back, the information they will ask from you, and emphatically the information they will never ask from you, then collectively we can stop these fraudsters getting any kind of foothold here. And I suppose the most important thing I would ask you to remember and to tell everybody you know is that if anybody phones you saying they're from Test and Protect and asks you for bank account details or a computer password, put the phone down on them, because no legitimate contact tracer needs that information from you and they will never ask you for that. So I think that's the most important thing to try to convey today. But I'll see if we can get you more of the facts and figures around it, Katrine, later on this afternoon. Chris Musson from The Sun.
Hi, First Minister. The new regulations for the 6 rule, they're including exemptions for organised activities, but organised activities typically cost money, and there are likely to be many activities that some less well-off parents perhaps can ill afford, such as sports clubs or dancing clubs for kids. So do you accept that an unintended consequence of this rule could be that less well-off parents can't afford to enable their children to socialise with groups of others outside school, while better off parents can? And can I check, did you carry out a children's rights impact assessment before passing the 6 regulation? And, to summarise, are the poorest in society bearing the brunt of what you've described as trade-offs?
Everybody's bearing the brunt of this to a greater or lesser extent, Chris, and I wish we weren't. I wish other people weren't. In terms of, obviously, these changes are made very quickly because of the nature of what they're trying to address. I will get you information later on in terms of the impact assessments that the coronavirus regulations generally go through. I guess, though, it is because I recognise that potential unintended consequence that I said last Friday. I was looking to see whether we could give greater flexibility generally for children under 12. So we initially said, and we still say, they don't count towards the limit of 6 people. At the moment, they count towards the 2 households, but we're looking to see whether we can give greater flexibility around that. And I hope to be able to say more about that, having taken the advice later this week. And if that's not possible, then there will be another thing we have to look at. Do we have to balance that in some other way to make it fair overall? I am acutely aware in every time we make one of these decisions that there potentially is an unintended consequence, that potentially it impacts more on one person or one group of people than it does on the other. And we try to think through that as much as possible. We try to make changes if things are brought to our attention that perhaps we hadn't thought of, but none of this is perfect and none of this is ever going to be perfect. What we are trying to do is limit household interactions as much as possible to try to stem the rise in the virus. But I will always listen to areas where we might not have got it absolutely right and try, if we can, to fix these anomalies as we go along. But don't ever think I'm not aware of the fact that everybody, and some more than others, I accept that, are bearing the impact of the trade-offs, yes, we're all having to make to try to keep an infectious virus under control. These are not easy things to do in terms of taking the decisions, but they're even harder for people to live with, and I am acutely aware of that. Michael Blackley from the Daily Mail.
Thank you. Good afternoon. On the test and protect fraud concerns, can you just confirm, did the Scottish Government become aware of these issues through Police Scotland? If not, can you say how you did become aware of this and whether you have contacted Police Scotland? And also just on testing, Robert Colgour of Renaissance Care has today said that his staff are waiting an average of 5 to 7 days for test results in recent weeks. Is that the average across the care home sector, and indeed is that an average for the wider testing problems? And do you share his concern that delays with staff testing could well cause a second wave of coronavirus in care homes?
Just on the issues with potential scams around Test and Protect, I am aware, because I've spoken about it today, that the Scottish Government is aware of some calls. I will have to go back and check exactly how that awareness came to the Scottish Government, and I'll get you further information on that. But we're trying here to, at an early stage, when there's any concern being raised, flag it up with people to try and prevent any of these attempted scams being successful. And I think that's the sensible way to go. But exactly how the concerns were first raised with is whether it came from the police or came from individuals reporting it. I'll have to go and double check. I share a concern about turnaround times for tests that are longer than we want them to be. And that's the issue we're trying to get on top of with the UK Government and resolve. Right now, our care home testing goes through that UK-wide scheme. But as I've said a couple of times, we are some health boards are looking to take that into the NHS lab side of it to free up capacity, but also to obviously put them more in control of the turnaround times of that. We are delving into these figures on a daily basis right now just to understand what the backlogs are, what the time delays are, and that's a moving picture. I hope it's an improving picture, but we are continuing to look at it on an ongoing basis. Conor Matchett from the Scotsman.
Thank you, First Minister. Just on testing and the backlog, if we can. I asked the Scottish Government yesterday what the number of tests, the number of tests in the backlog was, and they couldn't tell me. And I also asked the Department of Health down south what the number of tests in the backlog were, and that they said that testing capacity hasn't been compromised in Scotland, which I think is accurate from what you've said as well. You've been accused of playing politics about this. Could you help me out on this? What number of tests are in the backlog? Is there a number that we can point at, or a percentage?
I can't give you that right now for today, because we're still looking at it's a changing picture. So every day. So yesterday, I don't have the figure in front of me. There were, I think, around 12,000 tests processed through the UK system for Scotland. So that will have changed the backlog of yesterday. We need to now see how that is processed through the course of today and what that picture is. So it's not that we're not giving you a figure. It's a movable feast, but it's too high at the moment, and we're trying to get it down. In terms of testing system not being compromised, I don't quite know what that means. We don't at the moment, and I think this is a good thing. It suggests that demand in Scotland is probably where you would expect it to be given prevalence of the virus. People, and I'm not saying nobody had difficulty getting a booking slot at the time and place of their choosing, but overall we don't have an issue with people seeking testing slots and not getting those slots. The issue here is a slower than desired processing through the laboratory, and that's what we're working on, and hopefully that is a position that will improve. And as for the the comment about playing politics, I just genuinely don't understand that. You know, we've got a UK-wide system, we're working constructively together within that, but if there are issues in it, I think it's better to try to be upfront about those issues and talk about what we're doing to resolve them. That's not playing politics, that's just trying to make sure a system that is really crucially important for our fight against the virus is working as effectively as possible. And you know, part of that is me as First Minister trying to understand where the problems are so that I know what, if anything, the Scottish Government can do more of to try to help resolve these issues. It's that spirit of trying to find a partnership approach to resolving them that these discussions are taking place in. And the discussion I had with Matt Hancock and Dido Harding last night was a very constructive discussion that hopefully will play a part in resolving the issues. Mark McLaughlin from The Times.
Good afternoon. I want to follow up on what Chris Musson asked about children's parties. I'm still not entirely clear how many children are allowed at a children's party if there's no limit. I mean, could you have as many children at a house party as your sanity could bear, as long as there was 6 adults, only 6 adults supervising? And maybe looking ahead to next month, will children be allowed to go guising, do you think?
On the last question, I don't know. Mark, I wish I had a crystal ball sitting next to my magic wand and we'd be in a much different position right now. I don't. I don't want to be the person standing here telling children that they can't go guising. But if that is necessary because of where we are, then it's better than allowing children to be at risk. And I will try to take these decisions with my colleagues here in the best way with the overall interest of keeping the country as safe as we can. On the first part of your question, at the moment, you could have the limit on children under 12 at a house party is that it can't be children from more than 2 households. So you could have, if you have 4 children in one household and 3 children in another, they could all be together because they don't count towards the limit of 6 as long as the adults are complying with the limit of 6, but you can't have 6 children from 6 different households. Now, I know that's difficult to understand, but it's because the most important, both parts of the 6-2 rule are important, but actually the bit that really matters is the 2 households, because that's how we try to stop it going from household to household to household. And that's what we're looking at just now, whether we can exempt children a bit more from not just the 6 part of the rule, but from the 2 part of the rule. But if we're going to do that, we need to make sure that's not going to undermine what we're trying to achieve with this rule. Do you want to say any more, Jason?
Only that I imagine it'll be me that's wheeled out to cancel Halloween, since we cancelled Mother's Day, Father's Day, Easter. I have had early conversations actually with Parent Club, so a lot of parents watching will know what Parent Club is. It's our website with information for kids and parents. And we've had early conversations about what a safe Halloween might look like, pending the fact that we don't know where we're going to be, then we don't know what the prevalence will be, and we don't know if we'll have extra restrictions in place. But we are going to have to think about Halloween, as is every other country that celebrates or whatever you do at Halloween. The other thing about the 6-2 rule, I would just emphasise that the reason we have, in contrast to some other countries across Europe and even in the UK, have limited the household numbers, is we believe that the science teaches us that once it gets into your house, it's really quite difficult to avoid it infecting the people inside your house. So the crucial thing to try and stop is it getting into another house. And that's why the 2 household thing is so important. I also understand the difficulty with young children and them wanting to play with larger groups, and the difficulty when they've come from school where they're together to places where we're now telling them not to be together. But that's about reducing the risk overall. And the advice that the First Minister's asked for will be with her later this week. And it won't be risk-free. It will be options about what choices we can make about that particular issue.
Thanks. David Ball from the Herald.
Thank you, First Minister. The EIS has written to Holyrood's Education Committee, claiming the SQA failed to take notice of criticism ahead of the exams sort of U-turn that happened. The union has also called for the Scottish Government to direct the SQA to be more inclusive in its plans next year. I'm just wondering if you thought that was a fair assessment, or has the whole exam situation come as a bit of a surprise to the Scottish Government?
I think I've covered the ground of the results situation many times before, and been very candid about the fact we didn't get it right, and I have no hesitation in doing that again. No, I don't mean any disrespect to you when I say this, but I haven't seen that letter, and I always prefer to have seen a letter before I comment in detail on what my response to it might be. So happy to look at that and do that later. It strikes me, that there were, and I'm not making a comment without seeing the letter on the legitimacy of the situations, but the SQA before the exams was criticised by some for not consulting enough. Since then, when it's been looking at the curriculum impact of, looking ahead to the exam season next year, it's been criticised by some for having a consultation that then looks at options. So I simply make the point that it's often difficult for bodies to get it absolutely right in the balance of consultation. But, we always want organisations like the SQA to be inclusive and open in how they consult people about their plans. And I'm sure if that is the request in the letter, I'm not sure it will need a ministerial direction, nor am I sure that would be appropriate, but we would certainly encourage the greatest inclusivity in how the SQA does its work as possible. Daniel Sanderson from The Telegraph.
Thanks very much, First Minister. Just back on testing, you said yesterday that Jean Freeman had managed to resist an attempt to limit access to testing slots over the weekend. Can I just ask you to expand on why she did that? If the issue, as you say, is with processing the tests in the labs, why wouldn't it make sense to temporarily restrict access to the actual tests until this backlog could be brought under control? And also, you said earlier that you wanted to ensure Scotland continues to get its fair share of tests, but wouldn't it make sense to do this on a four nations basis? As you said, England is experiencing a particular surge in demand right now. Wouldn't it make sense to give over some of Scotland's capacity to England, and equally, if Scotland faces particular issues in future, some of England's capacity could be turned over to Scotland? Thanks.
So in relation to the first part of your question, I think we try to deal with issues of capacity in labs by dealing with the capacity in labs, not by constraining demand for tests, because we want people who have symptoms to be able to get tested. And at the weekend, we didn't think it was appropriate to respond to a constraint in the lab capacity that wasn't really being caused by Scottish demand by trying to peg back Scottish demand. And there was agreement around that. In relation to the second part of your question, broadly, yes, I do agree, and that's kind of how it works. It's a point I readily made with Matt Hancock last night. One of the advantages of having this as a UK networked system is it does allow you to flex capacity. A couple of weeks ago, when our schools went back, Scotland was probably doing more tests than our proportionate share. The difference is at that point, there wasn't the same overall constraints in the system. So that wasn't necessarily squeezing other parts of the UK out. I have no objection at all to that flexing of demand. What I don't want to have, though, is a situation where that squeezes or would, and I'm talking hypothetically at the moment, would squeeze Scotland's capacity so much that we started to have a backlog in our testing. We need to deal with this equitably and manage demand as far as possible. And that's I think the area of agreement. But we also need to continue to build up that capacity as we go into winter, and that's where we want to also work with the UK government to do that through the UK system and look at how we build and bring on stream more capacity of our own as well. Richard Percival from The Express.
Thank you, First Minister. Apologies, my video not seems to be working properly today. The UK has seen some of the highest COVID cases since May recently. But obviously, Michael Russell this morning said there was absolutely no trust left in the UK government this morning following the UK internal market vote last night. Are you worried that Brexit and the UK internal market bill are distracting politicians from across the country from dealing with coronavirus on a daily basis?
Yeah, I think that is a risk, but I'm not going to go any further than that because I've been very clear. These are COVID briefings and I'm not going to, you know my views on Brexit, you know my views on the internal market bill, but I'm going to stick here on the COVID issues. And lastly, Terry Murden from Daily Business.
Good afternoon, First Minister. Can you confirm that £250 million received from the UK government to help businesses is still unallocated? This is, you'd be well aware, a claim made by Scottish Labour. If that's the case, will you be releasing these funds? And are there any new schemes within your powers and resources to ensure that those who claim still to be overlooked will get a share of this money?
You said I'll be aware of this claim. I'm afraid I'm not aware of that claim, so that may be my fault, but I will have to go and look at that. Every penny of the consequentials that we've had will go to businesses. If there are unallocated parts, it's because it may be because there was an underspend in one part that we have taken back to reallocate, and it may be that we're deciding how to do that. But I'll look at the detail of the claim and give you a specific answer. We always look at schemes within our own powers and resources where we can help others that haven't been helped or give further help to those who have been helped, and we will continue to do that. But I'll end with the point that I make frequently, and it's not a political point, so I'm not straying into politics here, it's just a statement of fact. The Scottish Government budget is largely finite. The borrowing powers that are enabling the UK Government to fund the job retention scheme and these other schemes lie with the UK Government, and we can't access them, so we have to get the UK Government to access them for us, and if they are not willing to do that, then we would ask them to give us greater borrowing powers so we can do that. But when you have a largely finite budget, there is a limit to the additional financial schemes that you can put in place over and above what's been done. But we always look to see where we can flex resources as much as possible. That concludes our questions today. My thanks as always to journalists, to Yvonne, who's been doing our BSL interpretation today, and to Jason for helping me out with all the questions, particularly the ones about football. And thanks to you for joining us. Again, I know there was a lot of technicality in the update today, but it's important that we have the opportunity to share some of this with you as we go into the later phases of dealing with this pandemic. Can I bring us back, just to round off though, to the key points here? COVID's on the rise in Scotland, the UK, Europe and the world. We need to act collectively to stop it getting out of control and getting a real grip of us again. And that comes down to the things that we're asking everybody to do. Firstly, to limit household interactions. So the 6 people from no more than 2 households rule is really, really important. And I would ask everybody to make sure they stick to that every day right now. Of course, if you're in one of the 7 local authority areas where the restrictions are more severe than that, and we're asking you not to go into other people's houses at all, stick with that right now. The point Jason made is the one to bear in mind. The evidence tells us if one person in a household gets this, then it is likely most or all of the other members of the household will get it too. So we've got to stop it getting into households, which is why limiting your interaction with other households is so important. The second thing I would ask you to do, if you haven't already, is download Protect Scotland app. We are getting close to 1 million people having downloaded it. It would be good to reach that milestone and then go beyond that. So if you haven't done it yourself, or if you know anybody, particularly students and young people that haven't done it, please encourage them to do so. And lastly, please abide by the guidance in facts. Face coverings, stay away from crowded places or avoid crowded places, clean your hands and hard surfaces 2 metres distance, and self-isolate and book a test if you have symptoms. To end with a point I made in response to one of the questions, we know COVID's on the rise, we know it's an infectious virus, we know people can get it even doing all of these things, but we minimise the chances if we all do the right things. And so let's not think anything over the next few months is inevitable. It may come to pass, but let's not assume it's inevitable. Let's take the power we have to keep COVID under control and make sure we use it to the maximum possible advantage. Thank you very much for joining us. I will be back here at 12:15 tomorrow. And as you know, the BBC hopefully will be screening us live, but if not, then you can catch this briefing on the Scottish Government channels to keep up to date with everything that's happening. Thanks very much for now.